SITREP World Briefing for June 24, 2026. The United States and Iran reached a ceasefire deal that quickly restarted commercial movement through the Strait of Hormuz, the narrow waterway between Iran and Oman that carries a large share of the world's seaborne oil trade. Shipping traffic increased after the agreement took hold, with dozens of vessels resuming passage and 42 ships recorded moving through the strait on Saturday. The ceasefire did not immediately clear the backlog in the Gulf, where an evacuation plan was being organized for hundreds of ships carrying about 11,000 seafarers that had been stranded while a dispute over Hormuz transit tolls continued. U.S. Secretary of State Marco Rubio began a Gulf tour to discuss the Iran agreement with Arab partners. The Strait of Hormuz is one of the world's most strategically sensitive choke points, and even short interruptions can affect fuel markets, insurance costs, and naval deployments. By combining a ceasefire with renewed shipping and a parallel campaign to engage Gulf monarchies, Washington and Tehran have shifted the immediate crisis from open conflict toward enforcement and diplomacy. But the continued toll dispute and the need to move stranded crews show that normal passage has not yet been fully restored. The United States and Iran moved toward restarting technical talks next week, after their first high-level negotiations in Switzerland produced sharply different public accounts of what had been agreed. Pakistan, which has been acting as a mediator, said the technical discussions would resume, but Tehran pushed back against the U.S. description of a framework deal. Iran's foreign ministry said it had made no new commitments on nuclear sites, directly rejecting Vice President J.D. Vance's claim that inspectors would be invited back. That dispute matters because technical negotiations are where broad political understandings are translated into verifiable steps, and any gap between Washington's and Tehran's versions of the Swiss talks could delay progress on inspections, nuclear safeguards, and sanctions-related sequencing. The UK's climate watchdog warned that the British government's environmental plan is largely off track, saying many of the required measures are still achievable, but that ministers must shift from planning into delivery. The assessment pointed to slippage across the broader strategy rather than a single failure, making it a politically important intervention as the United Kingdom tries to meet legal climate and environmental targets through changes in housing, transport, energy use, and land management. One area cited as evidence of weak delivery was home heating, where the watchdog said growth in pump sales has stalled after a key government support program was cut. That matters because decarbonizing household heating is central to reducing emissions from buildings, and slower uptake raises the risk that later, sharper policy interventions will be needed if the government wants to keep its climate promises while avoiding higher, long-term costs for households, installers, and the electricity system. France confirmed its first Ebola case on Wednesday after identifying the virus in a doctor who had returned from a medical mission in the Democratic Republic of Congo. French authorities said the patient was diagnosed after arriving back in France. The current epidemic in the Democratic Republic of Congo has already killed more than 260 people. The patient's profession and recent work in the Democratic Republic of Congo are central to the case because Ebola spreads through direct contact with bodily fluids, which places healthcare workers among the highest risk groups during active outbreaks. France's confirmation means its hospitals and health authorities must now manage isolation, contact tracing, and monitoring protocols designed to prevent any secondary transmission on French territory. Imported cases are uncommon, but they are treated with exceptional caution. The Democratic Republic of Congo has faced repeated Ebola emergencies over the past decade, and medical teams operating there often work under intense pressure in remote or unstable areas where rapid containment is difficult. For France, the immediate challenge is treating the infected doctor and maintaining support for medical deployments to outbreak regions. Sources and the full written briefing are available at sitrepbrief.com.